True or false? 10 misconceptions about breastfeeding. Having small breasts prevents breastfeeding. It's painful, you have to follow a special diet. Figaro takes stock of received ideas about breastfeeding. While the World Health Organization, WHO, recommends exclusive breastfeeding up to 6 months, only 19% of infants of this age are breastfed in France. In the Paris region, 70% of mothers want to breastfeed exclusively, but from the 3rd day, a quarter of them give up because of a lack of support or the contradictory discourse that is circulating, deplores Dr Virginie Rigourd, neonatology pediatrician at Necker Hospital, Paris, and head of the Ile de France regional lactarium. Preconceived ideas about breastfeeding are one of the main factors of failure. Figaro has selected T. 1. It is normal to have pain while breastfeeding. True and false. Breastfeeding shouldn't hurt, assures Dr Rigourd from the outset. If this is the case, you must not stay with your pie. You must consult a health professional trained in breastfeeding to remedy it. It is often due to poor positioning of the baby or even to a pre-existing complication such as crack. Certainly, in the first days, the breasts can be very sensitive or even painful at the start of feeding. Then everything is back to normal if the latch is done correct. 2. Breastfeeding is tiring. False. The difference in sleep is almost non-existent between the breastfeeding woman and the one who gives the bottle, according to the French Society of Pediatric. In theory, a breastfeeding woman goes back to sleep more quickly in deep sleep after feeding, thanks to the action of 2 hormones, prolactin and oxytocin. The fatigue stems more from all the upheavals linked to the arrival of the baby than from breastfeeding itself, specifies Dr Rigourd. 3. My milk is not good enough for my baby. False. In any case, breast milk is perfectly adapted to the needs of the child. When the child does not gain enough weight, it is not the quality of the milk which is in question, but the quantity drunk by the child which, obviously, turns out to be insufficient. 4. I have small breasts, I will not be able to breastfeed. False. All women can breastfeed, regardless of the size of their breasts, except in very special cases such as after breast surgery, says Dr Rigourd. Indeed, the production of milk is in no way conditioned by the size of the breasts, which is not determined by the mammary gland, where breast milk is made, but by the adipose tissue. Say Fa. When a woman does not produce enough milk, which results in the baby not growing well, it is because breastfeeding has not been properly started, explains the pediatrician. In this case, it is necessary to restart breastfeeding by putting the baby to the breast more frequently, by giving to both breasts, by emptying the breasts well, massage and compression during and at the end of feeding, or even by using a breast pump. 5. Breastfeeding damages the breasts. False. It is above all pregnancy that changes the breast. During this period, there is an accumulation of fat, which naturally melts after pregnancy, explains Dr Rigourd. Age and tobacco are also risk factors linked to a decrease in skin elasticity. 6. You have to drink liters of water a day to have milk. False. Milk production does not depend on the amounts of water drunk by the moth. It is the sucking of the baby and the emptying of the breast that stimulates the secretion of milk. Breastfeeding women should therefore drink normally, to their thirst. 7. Certain foods are to be avoided when breastfeeding. False. There are no dietary restrictions while breastfeeding. On the other hand, it is recommended to have a balanced and diversified diet. Some atypical diets, such as the vegan diet, require nutrient supplementation, vitamin B12 for vegans. It is obviously not recommended to consume alcohol, but moderate occasional consumption, less than 2 glasses in a day, does not require a suspension of breastfeeding, according to the French Society of Pediatric. Beyond that, there may be harmful effects for the baby as well as a decrease in milk production, as is the case with tobacco. For coffee and tea, it is better to stick to 2 to 3 cups a day maximum. 8. Breastfeeding prevents the occurrence of a new pregnancy. True and false. It is true that breastfeeding can prevent the return of diapers, but it is by no means an infallible method of contraceptio. It's a bad contraceptive, says the pediatrician. It must be exclusive and feedings must be frequent. But even if these conditions are met and the period has not returned, it does not 100% prevent a new pregnancy. 9. Babies fed industrial milk sleep better. Fowls. The rhythm of sleep does not depend solely on the mode of feeding, affirms Dr. Rigourd. In contrast, formula-fed infants are more prone to colic and reflux. 10. Better not to mix breastfeeding and industrial milk bottles. Fowls. It is quite possible to combine the two, reassures the doctor. If a mother wishes to do mixed breastfeeding, she must be support. On the other hand, during exclusive breastfeeding, the introduction of artificial milk can disrupt breastfeeding and therefore promote complications such as insufficient milk production, milk engorgement or mastitis, inflammation of the breasts. Editor's note.